I grew up in central Massachusetts, mostly in Shrewsbury, Massachusetts, although my father is from Ireland and my mom is from the Outer Hebrides off the coast of Scotland. So they got married and moved to London. So my brother and I were born there and then moved to Kansas City when I was 6, and we lived in the United States after that. I've always been interested in medicine. The only relative who was in medicine was a great uncle who was the family practitioner, the general practitioner on the Isle of Skye. So I definitely grew up with stories of him and his house calls and house visits. OBGYN always intrigued me because it really spans the whole gamut of women's health. And I've always been very interested in taking care specifically of women who are really the linchpins, I think, of our society. Well, it's a little bit like it takes a village to thoroughly take care of a patient sometimes. In maternal fetal medicine, we work very closely with patients' primary providers, so they're midwives or physicians. And then on top of that, if a patient does need sort of more multidisciplinary care, then we will often seek consults from other providers within the South Shore network, for example, neurology, cardiology, anesthesiology, nephrology, to name a few. Sometimes we need to involve specialists in town at a tertiary hospital. So we might need to involve Children's Hospital to plan carefully for a delivery of a baby that might need specific attention after birth. We also work closely with our colleagues at the tertiary care hospitals like Brigham and Women's, Beth Israel, Mass General, Tufts, because occasionally a patient might need transfer for a higher level of care. Try to just make sure that we treat all of our patients with the greatest of respect and compassion and understanding.